Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. We often talk about IVF and ICSI being the treatment options when a patient comes for infertility solutions. Of course, there are a lot more treatment options given before IVF and ICSI if you're eligible for it, such as ovulation induction with timed intercourse or IUI, intrauterine insemination. But IVF and ICSI is something that we talk about. But what is the difference between IVF and ICSI? IVF is in vitro fertilization and ICSI is intracytoplasmic sperm injection. To understand IVF, we need to understand what's happening physiologically, as in it's inside your body. When sperms are released inside the uterus after intercourse, the sperms swim up towards the tube where the egg is waiting. Once they reach the egg, one sperm enters the egg and fertilizes it, after which there is cell division and an embryo is formed. And this embryo, after a few days, about 5 to 7 days, it comes into the uterus and implants. So this is what is happening naturally inside your body at the time of fertilization and pregnancy. In IVF, we are trying to mimic physiology, mimic what's happening inside your body. But in IVF, the eggs are removed from the body after giving you some medication, some injections for growing them. Once they are of the right size, under anesthesia, these eggs are retrieved, and in a petri dish, in a highly sterile condition in an IVF laboratory, the eggs are left to be inseminated with your partner's sperm. What is happening is there is a calculation: how many eggs, how many sperms, what is the motility of these sperms, what is the count and concentration of the sperms. All these are calculated and sperms are left with the eggs to fertilize on their own. So we're trying to mimic physiology, mimic nature, wherein the best sperm will go and enter the egg. So this is IVF. In intracytoplasmic sperm injection, the sperm selection is based on the observer's discretion, who is the embryologist. The embryologist selects the best looking sperm in terms of morphology, in terms of its capacity to fertilize an egg, and puts one sperm inside single egg. This is a procedure which is repeated for any number of eggs that are retrieved. So if there are 10 eggs, inside these 10 eggs, a single mature sperm is put, provided the egg is also mature. This is also based on the embryologist's description, based on some morphological identities. So the difference is that in IVF, more or less, we are leaving the sperms with the egg and there is a natural selection of the sperms. In ICSI, the sperm is selected by the embryologist. Now, IVF is done for patients who have a number of eggs. The sperms are also of good quality and there is an assumption that good number of embryos will be formed. In ICSI, the procedure is mainly opted because there is morphological defects in sperms, or the sperms are retrieved from the testis through a procedure which is surgical, or there is a previous IVF failure. All these criterion qualify for ICSI, intracytoplasmic sperm injection. With IVF, there is a risk of no embryo formation also, because maybe the sperm does not enter the egg, or the best sperm does not enter the egg. In such cases, there is fertilization failure, due to which the entire cycle can be lost, the entire egg pool can be destroyed. So this is the problem. Also, if the sperm sample has any infection, the eggs also can contract this infection and be disintegrated, or maybe there is no embryo formation. So these are the problems with IVF. But with intracytoplasmic sperm injection, because the sperm is selected based on the embryologist's experience and skill, the fertilization is much higher, the embryo formation rate is much higher, the success rate is comparable, but the number of embryos, because are more in intracytoplasmic sperm injection, the choice then becomes more and there are more embryos to freeze finally. The kind of procedure which is selected, IVF or ICSI, is based on your criteria, that is, how is the egg quality, how are the sperms count quality and morphology. All these things are very, very important when the embryologist and your clinician decide what procedure will work best for you. To understand more about this IVF and ICSI, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.